Hi, everyone. Welcome to another episode of the Horses Advocate podcast. Thanks for tuning in. Thanks for listening. I appreciate you being here. Most of you know that I make a living as a veterinarian, just focused on taking care of horses' teeth. And if you follow me at all, you know that I do the old-fashioned type of dentistry, which means that I walk up to a horse and I don't automatically medicate them. I don't jack their mouth open. I don't restrain their head. I basically use hand floats, so I don't even own a piece of power equipment. And I also don't own a mouth speculum. If you came to my house and dug around my drawers, you'll find a mouth speculum that somebody gave me because a veterinarian retired and it got moved to somebody else, and they gave it to me because they thought I'd be interested. So I actually have one. I've never put it in a horse's mouth. I have used them way back in the past. I've used them at wet labs in demonstrations for how to use power equipment. And I haven't liked it because it interferes with my movement. It blocks the way I get around that horse's mouth. But of course, like anything else, I'm sure that if I gave myself a chance, I would probably figure out how to get around it, use it better. But I got to tell you, there's nothing better than not having anything to worry about, as far as blocking me. So no, I don't use the speculum. I don't automatically medicate. I have a podcast on medications, the use of medications in equine dentistry. I think it was one of my first podcasts where I talked about the reason for medicating a horse is to get rid of the pain that they are experiencing. Pain is subjective. It is not objective, which means it's in the individual's mind on how painful something is. We call that the threshold of pain. And I think I've had a podcast on that, where I certainly have stuff on the website, thehorsesadvocate.com. And if you haven't become a member, I would like you to think about that this year. As an encyclopedia of information. In fact, just as a sidebar here, I've spent 3 or 4 days just restructuring the site to make it a little bit easier to get around. And I'm realizing just how much information I have there. It is so loaded that you could go in there and spend a year. And what I know I need to do is get in there and make some more courses that are focused on certain things and have people just take a 6-day, 7-day block of time, become more familiarized with some of the pieces of information I have in there. But I stray a lot. I'm going to come back to equine dentistry and why I do it without automatically medicating. And that is because medication is there for the horse to help the horse through the process that they're experiencing, not to make my life easier. It is more difficult to float horses' teeth without drugging them. There's no doubt. Every time I medicate a horse, it does usually become easier. There's less anxiety. There's certainly less fighting from a horse that is no longer experiencing pain, so I don't do that. The whole purpose of this podcast, though, is to bring to you the information that I took away from the American Association of Equine Practitioners annual meeting, 2021 annual meeting held in December of 2021, where they had a whole section about 5 or 6, 7, I think it was 8. It was 9. 9 presentations. And I listened to them all. I took notes. I took my tests, so I got my CE credit for them. But I walk away still just dumbfounded and my head shaking. I find that my colleagues are slowly coming to realize that it is not a big a deal as they think it is, yet they're still trying to make it a bigger deal than it is. And what I mean by that is they slip in little one-liners tucked between their talks that basically start to agree with what I'm saying. And not that I know everything. I don't, just because I've done this for so many years, it's like 39 years this year of floating teeth. That's tens of thousands of horses. Doesn't mean I've seen everything and know everything. But I'm still baffled by the scientific method or the lack thereof in equine dentistry. And they tried to give me information that seems so official, so constructive, and yet it leaves me asking the same questions over and over again. And again, most of you who've been with me for a while know that I am question everything that comes my way. In fact, I'm coming up on what we call the rounds at the Horses Advocate. The Horses Advocate is the members only site where we really can dig into some of these issues and try to understand the information that they're giving to us, trying to make us aware. Sorry, I'm pausing for a second because I'm getting this horrible flashing on my screen. And if you're watching this in video, that was pretty annoying. Hopefully that fixed it. I hate it when I start talking, then I break away and I forget what I'm saying. I'm just so excited about bringing you this information because I like to talk about, oh, that's right, scientific information and what the difference is between anecdotal observational studies and the gold standard of double-blind, placebo-controlled, randomized selected trials, what they call CRTs, controlled randomized trials, which are technically the gold standard. And I talked about this in another podcast called the Parachute Study, where using one of these gold standard scientific studies, it was proven that we could jump out of an airplane without a parachute and not have any problems. We'll land safely on the ground. There's one line in the materials and methods that said the plane was sitting on the ground, engines off, and the door about 4 feet off the ground. And if you read that one line in there, then the whole study made sense. But if you missed it, then you'd say, gosh, maybe I don't need a parachute to jump out of a perfectly good airplane at 20,000 feet. So scientific energy, scientific studies are fraught with bias and problems. And I'm going to get into that in the rounds that I'm going to be putting on the end of this month. And if you aren't a member, you should think about joining. And if you join and the rounds are already over and you're hearing this later on in life, I always have the replay on there. It's going to be pretty interesting. But let's talk about equine dentistry. According to the panel of people, experts in their field, all veterinarians, all practicing dentistry as their main line of business. And they broke it up into 8 different parts. The 9th part was the panel discussion. The first section was how to perform a thorough oral examination. And this is always interesting because they believe in using a light source, using your eyes to visualize everything, using certain instruments to measure depth of decay in a pulp chamber. And let's see what else. They talk about us heavily sedating the horse and opening the mouth with a speculum. I call it a mouth jack, but we'll stick with speculum. And they also say flush the mouth out. Now, right away, we already have so many things that are wrong with this approach. And this is really important because the belief of most veterinarian dentists is that they need a clean space, a non-moving space, a wide open space, a well-lit space before they can start to analyze what's going on. And from my approach, number one, I find the willingness of a horse, which I think is most important. I make a connection with the horse, which is the reason why I get up in the morning, go out and work with these creatures. It's not to ask how many horses teeth I can float. And by sedating them all, I can add 1 or 2 extra in a day. I look at it as my joy in life is to meet a horse I've never met before and connect with them and say, look, I'm here to help you. And if you're willing to help me help you, we can have a really good time here. In about 30 minutes, you're going to have your head down, just shaking unbelief, disbelief that all that pain in your mouth is gone. Because it's all about the pain. Don't let anybody else fool you. It's always about the pain, the removal of the cause of pain in the horse's mouth that makes everything. It improves the health of the horse, meaning that if there's no pain, the tongue can move around, the jaw can move freely. And with this free movement, you get the way the jaw was supposed to be taken care of, and it increases their health. But I'll get back to that in a little bit. But according to this, that you need to heavily sedate, jack the mouth open, clean it, and use a light source. Well, I've gone up to a lot of my clients who are wearing their hair in a ponytail, and I look them straight in the eye and I say, first, don't freak out. But I take my hand and I move my hand around the back of their head. And I said, I can't see how you have your hair tied up, but I can feel that you've got a scrunchie or a hair clip, or you've got just a rubber band. You've got something. I can feel it. I can identify it. I can find out if there's one ponytail or two pigtails. I can do this all with my eyes closed, or me just looking at them in their eyes and feeling what my eyes can't see. So I trust my fingers more in a horse's mouth than a light source, because even with mirrors and pushing tissue out of the way, I'm sure that people have gotten very good at identifying things. And there's no doubt when I see the endoscopy, the interior photographs of what's inside a horse's mouth, it blows me away. And I've been inside a lot of horses' mouths, and it's so cool to see all these things and identify them all. But we have to understand that that one day is a one moment in a long period of time. In most horses, it's been 365 days. And a lot can happen in 365 days. And just because I see it there today doesn't mean it's going to be there tomorrow, or it was there yesterday. So, and trust me, when I say that, yes, I understand that if you have periodontal disease, which is inflammation of an infection of the gum line, or a diastema, which is the space between two teeth, or you've got an abscess, you've got pocketed food. Yes, it's probably been there for a while, but we all think that once we see something, we have to do something about it. But just like you break a bone, if you give it enough time, it will heal almost all the time. Yes, we can immobilize the area and let the bone heal faster. And yes, we can go in there and clean up these periopockets and make things better. But I asked myself the question, what did horses do long before we came along? How did they solve all these problems? And I think that's a really important question to ask. So the light source, I don't use my eyes, so I don't need a light source. I feel. And when I come out with my hands, I've got so much information. Not only have I felt ulcers, cheek ulcers, I've felt periodontal periopockets, that soft, squishy tissue that's between the gum and the tooth. I can smell a bad odor, whether it's copophagy, where they're eating their own manure, an infection, an anaerobic infection like a pus smell. I can smell necrotic tissue, and I can smell fermenting food, of packed food. And those are 5 distinct smells that and the stale smell. Stale is really important. In the older horses, you come out, the tongue hasn't been moving because they're so sore that everything's become stale in there. I call it old man smell, like granddad, oh, dad, grandpa, can't you brush your teeth? And these horses can't. And just with my palpation, I can smell those 5 distinct smells. I can feel any sharp points. I can feel for broken teeth. I can feel for periopockets. I can smell the periopockets. I can elicit pain by touching certain areas and get a sense of what the threshold of pain is for this horse, whether the horse is going to help me or not. Or just as importantly, if my removal of sharp points is going to make this horse feel better. I can also feel for wiggling teeth. If a wiggle on my fingers, if it's an old horse tooth and it's end stage tooth, many times I can just grab it with my fingers and pull the tooth out because there's nothing holding it anymore. Other times it's wiggling, 10, 15, 20 degrees side to side. For you guys who are not into math, 90 degrees means it goes at a right angle from straight up to sideways. And I've been able to move it almost that far, but the horse just can't get the tooth out because it's stuck between 2 permanent teeth. So I just go in there and either reach with my fingers or some forceps, and without any pain medication, I just pop that sucker out, and the horse's eyeballs just like, oh my God, that's been bothering me for so long. Thank you, you took care of that thing. And I don't even have to medicate them. So yeah, my thorough oral exam is all through palpation, feedback from the horse, which you can't get if they're schnockered, over-medicated, over-sedated, and smell. So there's a lot of information that I get. I don't need to map out exactly where all the sharp points are. I do say that the horse is sharper on the left because most horses are, if they haven't been floated for a while, they're almost always sharp on the left. Just like you might be more predominantly, you predominantly favor your right hand for writing. Some of you, your left hand, you choose the side and you learn to use with it. Well, same with chewing. when you chew, most of the food goes into one side of your mouth and you chew on it on one side. And I think from experience, most horses like to chew on one side. I don't know whether it's the left or right side, but most horses that I see are sharper on the left side. And that's just a normal finding. They say that I need to take a full history physical exam. Well, that's true, but I could care less if the horse has a cut on his left hind, or if he's had a suspensory ligament, or any of these other things that are bothering the horse. I'm more interested in what's going on in the mouth. I do consider other medications the horse is on. I think that's important to know, because most medications are altering the gut microbiome of the horse's mouth. And that can lead to, through the altered microbiome, cavities of the teeth. You can feel, my fingers can feel the depression of where the pulp chambers are starting to erode and starting to coalesce. And I call it, what do I call that? Anyway, I call it a decay of the teeth, and that's really common. But nobody's asking the question, why are they decaying? I have yet to see anybody do any scientific studies to understand why the teeth are starting to decay, why they're starting to fracture. And by the way, I feel fractured teeth all the time. I can feel it with my fingers, or as I float, I can hear it rattle, and I can go in and extract them all right there using a mild pain medication and go in the mouth. Doesn't matter which tooth. I've taken the outside edge of the very last bottom right cheek tooth of a miniature donkey in the field using my hands and forceps. I will admit that was a tough one. That one made me cry because there just wasn't any space in the horse's mouth to work. But I can't imagine any more space using heavy medications in a mouth jack. It's just no space. It's just almost impossible. But I got her done, and that was quite an event. I'm pretty happy about that one. Soft tissue, I can feel the cheek ulcers with my fingers, just like you can feel if you put the inside of your cheek with your tongue. So this whole first section was advanced dentistry for field uses, how to perform a thorough oral exam. That's the presenter's point of view of using a light source, heavy sedation, and cleaning the mouth out. Oh, that was the other thing about cleaning the mouth out. A lot of these guys will just go and flush the mouth out, just flush it really well before they even go in and examine. For me, I want to know if the horse is packing food. If the horse hasn't been eating for, let's say, 20 or 30 minutes before I start doing an exam, he's in a stall with no hay at all, and I go in and I find that he's kept hay, it's scattered throughout his mouth, that tells me that he's having trouble moving his tongue. Or if it's packed on one side, that tells me he's having trouble moving his tongue, cleaning that side out. And then on occasion, I'll look at a golf ball size, mushy ball of hay that's hanging out in the very, very back corner of the mouth. And it's just round. It's just been rolling around back there, filled with saliva. And at some point, the horse will swallow it. But it's almost like they're holding on to it, or they're just having difficulty getting it down. Maybe the horse needs to drink water, swish it out of there. I'm not sure, but it doesn't stink. There's no odor to it. It's pretty fresh. But after I clean that out and go back there, I usually find very sharp areas of the cheek teeth. And more importantly, in these horses, I'll find a space between the last tooth. I'll find a space between the last tooth and the jawbone, and I just clean that all up. They also said, last thing, they prefer dormocidine to totamine, which is a heavy sedation drug, mixed with butorphanol, the torbigesic, as their primary use for medicating a horse. Dorm just knocks the socks off the horse, and Torb is a potent analgesic drug. But for some reason, they never mention, or hardly ever mention, xylazine, which is also a very potent sedative, but much more able to reduce or relieve pain from the oral mucosa. And I find that xylazine or Rompum, or whatever it is in your country, xylazine works so much better for relieving pain and giving some sedation. So I don't even use Dorm. I don't even have it in my equipment. I don't buy it. To me, it's a worthless drug for inside the mouth. Great drug for other things, sewing up the ears, eyelids, whatever is fine, but not for being inside the mouth. That's just my opinion. Later on, somebody said they add xylazine. And I've heard this before. They'll add xylazine if DORM isn't working. I find that fascinating. Okay, the second section was how to obtain diagnostic dental radiographs. And this is pretty interesting for a couple of reasons. The guy was very thorough. He's very good at what he does. He helped me learn how to identify what position the plate was in, what they call the sensor and X-ray generator. So the sensor is on the backside, it's equivalent to film, and the generator is the machine that shoots the X-rays through the head. And it was really good. If I ever decided to start taking radiographs of a horse's mouth, I would have gotten a lot out of this information. I just haven't seen the benefit of X-rays. I know that they're there, but I'm just, for the value, if I were in a clinic where I was being brought all these horses that had snotty noses, et cetera, yes, it's great. And I think it's wonderful to get X-rays there. But 9 out of 10 horses, maybe 99 out of 100, don't need radiographs. You can pretty much figure out what's going on without the radiographs. But I don't want to diminish what they're trying to say. I think, again, he did a really good job. I was shocked because I was told so many times how important it was to keep the X-rays away from our bodies. Don't handhold the machine. Don't stand in front of the beam. And yet all these people would just handhold the machine and have somebody holding the plate. And to me, that's not good hygiene for radiographic equipment. You won't see that in any other place. The operators are always hiding from the X-rays. Everyone's telling you don't get an MRI unless you absolutely need to because you're being bombarded with the X-rays. Same with CT scans. And yet they're going out there all the time. In fact, just last month, I helped a veterinarian hold the plate so he could take skull radiographs. And I'm thinking, I'm not protecting my body at all. I mean, I don't have gloves on, let alone anything covering my private parts. Not that I need them anymore, but it was just nobody's protecting themselves. So that really bothered me a little bit. And yet this is being said at an AAEP conference. Maybe I'm out of the loop. Maybe these generators don't throw off any X-rays that bother us anymore, but I doubt it. All right, the third presentation was how to recognize and evaluate periodontal disease. Now, just to remind you, periodontal disease is where the gum line that attaches the gum to the tooth that's sealed off gets a break in it and gets bacteria growing in it and gets macerated or soft or smelly or all of the above. Can be painful. Sometimes they're incidental findings on a horse. They don't care. They could care less. It's not painful. But when I stick my hand in, I can feel these. I bring my hand out, I can smell it. And so I know that the problem's there. Now, the question is, why is it there? And nobody's been able to answer that. I've never seen anybody giving me a study where they took 100 horses and they looked at for periodontal disease, and then they worked backwards from there and tried to figure out what caused it. Or better yet, they took horses that didn't have periodontal disease and created the disease. Nobody's done that. I am suspicious of two things. One, a cap remnant. Cap remnants are the baby teeth, what they call the deciduous teeth, that sits on top of the permanent teeth in all young horses. And by 5 years of age, maybe 4 years of age, that cap has completely come off. But that cap has little teeth. Those teeth stick down around the permanent tooth. And those, it's odd that I'm saying the word teeth on a tooth. Let's put it differently. If you look at a cap that you're wearing on top of your head and you drop two strings around and tie it under your chin, it's those strings, it's those fingers, it's that whatever it is that attaches the hat to your head to hold on to it longer, so a small breeze isn't going to blow off your head. It's the best way I can describe these little fingers that are on the deciduous teeth. They go down into the gum line and embrace the permanent tooth. So make sure that it stays on there for 2 or 3 or 4 years before the permanent tooth underneath it pushes up and erupts it off and sheds it away. But in that shedding process, you can have these little tips of the fingers break off. And I've seen these tips come out years later, like they're over 10, 12, 14 years of age. I'll go in and say, oh, what's this? And it's one of these cap remnants that finally comes out, no problems. I'm suspicious that in some of these horses, periodontal disease, that's all it is. It's a cap remnant that's finally worked its way out, and it's coming out at the gum line. And during that exam, we're seeing it. Yes, it's infected. Yes, it stinks. It may be sore, but it'll clear itself up almost every time after a good floating where the tongue get in there and clean things up. Remember, the purpose of the tongue in all horses and people and every animal. I mean, think about this. Every animal you can think of has a tongue, including the snake, including the whale. I mean, everyone has a tongue. That's how important it is. In fact, there's a specific nerve that comes straight from your brain to your tongue to innervate it. So it keeps moving out of the way as you chew, or as I'm talking to you, I'm not constantly biting it. It's an amazing organ, or not organ, but it's an amazing piece of muscle that is highly innervated and works so beautifully. But one of the many purposes of the tongue is to clean up the mouth. It cleans, it lubricates, it distributes saliva. In that saliva are the immunoglobulins of the mouth that kill all the bacteria. And keep in mind that inside your mouth is outside your body. It's a very dirty place. It's filled with bacteria, 700, 1,200 individual families of bacteria that live in there. And it's constantly distributing it, trying to make it as healthy as can be. The tongue also pushes the tooth, and by pushing the tooth, the tooth will resist that pushing and make its attachment stronger. So horses that don't move their tongue will end up having very loose teeth, and you file off the sharp edges and allow the tongue to push up against the tooth. And next thing you know, the teeth are sharp, are solid in the socket, usually within 2 to 3 months of you doing that. So periodontal disease is whatever's going on next to the bone. And the presenter said, you need to take x-rays and you're looking for this and that. I'm not going to go over it because you guys aren't veterinarians. If you are a veterinarian, go to the AAEP conference and you can listen to this podcast, their broadcast of it. But you're looking for certain identifying marks of the tooth to determine what's going on. But then he didn't really say what to do, which is kind of weird, but that's okay, because the next presenter said, equipment and treatment of periodontal disease. Well, the first thing he says is widen the diastema. That's a fancy word for a space between two teeth. And whenever you get a space between two teeth, you're going to get food that's stuck in there. And if it gets stuck in there, you're going to get inflammation. You're going to get bacterial growth that's from the fermentation process. And same with a human. If you don't clean those teeth out, it's going to be a problem. So there are a couple of reasons for diastemas in horses' teeth. One is a loss of tooth. That's pretty common. More commonly, they get a fracture of the tooth that goes from the inside of the tooth to the outside, not from front to back, but from side to side. And it takes a chunk of tooth out. And now we've got space for food to get caught in there, and that can get in toward the gum line. But what I really found fascinating, put a couple exclamation points next to this in the notes, but he said the treatment is float. And I'm like, I couldn't agree more. If you float the teeth, get all sources of pain away so the tongue can move clearly and cleanly through the mouth, it will take care of most of these periodontal diseases. At least in my opinion, of the horses that I've seen where I see a periodontal pocket or periodontal disease, I'll note it in the record. I'll come back in 6 months and it's nowhere to be found. It's gone without any other treatment other than floating almost every time. And on a rare occasion, it's taken a year or more to clean up, but the owners never said that the horse has any problem chewing. The teeth doesn't decay, doesn't die. It just seems to keep going just fine. It's interesting to note that in this presentation, the vet said that you have to be cautious in using the burr. What happens is they take a spinning burr at a right angle, and wherever the tooth has a diastema, it'll spin down and create a wider gap. And I think that's a pretty cool way of taking care of things. But he says oftentimes in the widening of the gap, you actually enter the pulp chamber of a healthy tooth. And that never is good, because now you've basically exposed that sterile environment to the bacteria of the mouth. And that can cause an infection that can travel up the root and create a abscess in the tooth, which will lead to other problems. So he said use the skinniest burr as possible. and adjust the angle of approach to make sure that you don't hit the pulp. So you've got that risk. Plus the horse is heavily sedated. He says it must be heavily sedated and possibly a regional nerve block just to make sure that the horse isn't going to move, because if it moves and you go zzz, and it's too late, you've taken off a tooth that's exposed to the pulp chamber. He also said, go in steps, go really slow. You have to go beyond the gum line, or what he calls the gingival margin. And then it says use a water pick or air and water and really clean up the area, although that can damage it too. And you want to try and get all the food out of there. But as far as I know, every horse I've ever worked on, the first thing you do after working on them is say, go eat food. So it's kind of hard. He suggests maybe packing these areas with some packing material until the diseased gum line can heal. But again, there are no scientific studies. There's no studies where they took 20 horses, all with periodontal disease. 6 of them, they did nothing. 7 of them, they did the packing, and the other remainder, they just did the drilling without the packing. Nobody's ever done that, so they don't have any conclusions. He did say that 75% of the horses that it does do the diastema widening actually do well long-term, but 25% of them need additional work. And so you have to constantly be rechecking these horses. Again, we don't know what it would be like if they didn't do anything. I've seen tons of horses with diastemas with food packed in there, and I push it out. I push it out with my fingers. I clean it out the best I can, and I come back and there's no more diastema, So nobody's looking at that. I think it's great that we can go in and do these things, but doing nothing other than taking the sharp teeth away and allowing those teeth to now get the pressure of chewing and the pressure of the tongue, they will actually adjust. The horses will take care of it. At least that's what I found in my practice. So that's the treating the periodontal disease. The next one was recognize and manage age-related dental problems. Oh, good grief. Yeah, if the tooth is wiggling, you pull out with your fingers, pull it out. Much better to train everybody to take care of routine dental care. All the horses that I've done work on for, 5+ years, certainly 10, 15 years, when they hit their older golden years, their teeth are in pretty good shape. I will say that the earlier you start, the better the longevity is on these. I don't have accurate data, but I do know that if I see a horse for the first time, he's 20 years old, yeah, by 22 to 25, they've got teeth that are broken. They've got other problems that we try to take care of, and it's just a matter of time. But those horses that I've done for 20 years, the teeth are like, they're pristine. They're just beautiful. So yeah, I think dentistry, routine dentistry from a young age is great. I think a lot of these older horses, they see a dentist for the first time when they're 15, 20, 25 years old. And that's always a problem. I don't think there's a colleague of mine out there who would argue with that fact. But I am arguing with them when they say just pull the teeth, especially for EOTRH. If you don't know what that is, that's where the bone that underlies the front teeth, the incisors, the nippers, the bone becomes inflamed and it dies, and they see it on radiographs, and it causes the tooth to fall out through a process of gum recession and abscess formation. And finally, the tooth is just ejected because there's no more blood coming to it. We see it as ugly teeth of old horses, and we freak out. Oh my gosh, look at this. This is horrible. We got to pull the tooth. Well, that's like, the horse is long gone and you're going to close the doors to the barn. The cause never has been addressed, and you're taking the teeth out just to make the horse feel good. Some horses, it does make them feel better because they're so painful. But I find that adding shredded mushrooms will help to bind to the lectins that are in your grains. And that seems to make some of these horses feel better. The reports I've gotten back from people is that in less than a week on the shredded mushrooms, the horse is running around just so pain-free and just feeling so much better. Of course, I tell people that I believe, this is just my opinion, that the cause is an autoimmune disease caused by the grains that are in the diet, the lectins, the plant proteins that are in the grains. I'm hearing a siren. somebody's having a bad day. Sorry about that. We got the windows open down here in South Florida because it's winter and it's actually rather cool out today. Sorry for that break. It's just, that's life. Every time you think you're having a bad day, just think there's somebody else out there having a bad day too. That's just my philosophy. And if you're having a bad day, look at it as an opportunity to grow and learn, and look forward to the next day to do better. Yeah, sorry for the coaching there. That's how I get through life. Anyway, in the EOTRH, I believe that it's the lectins that are causing an autoimmune disease. That was actually based on what Patty Dixon, a veterinarian out of Edinburgh, Scotland, said. I'll give him credit for mentioning that he thought it was an autoimmune disease. And in humans, mushrooms have been known to bind to lectins to prevent leaky gut syndrome. And I think that's what's happening. We're getting leaky gut syndrome at the mouth. Nobody's offered a better explanation. Nobody's put up a couple of $1 million to get a bunch of horses and see if we can induce EOTRH in a bunch of horses, because that would take 25 years of feeding the horses grain. And I don't think that's ethical, but on and on we go. The next presenter talked about how to refer somebody for a dentistry case, and that was pretty simple. They said, usually we don't get enough information. We need to know everything. So if you're ever going to refer a case into somebody to referral practice for dental work, make sure that all your radiographs and all your history is in order before it goes. Now, this next guy was pretty interesting. He described misting. MIST is minimally invasive sinoscopy technique, MIST. And he basically took a 14 gauge needle and a hammer and created a small hole in their sinus. And we do this all the time. You put a little bleb of anesthetic in, you pop that needle in, and then you can flush saline in and flush out a sinus that's filled with pus. I know lots of vets who do that. I don't do it because I'm not around to do the follow-up, but I'll suggest to some people if they're trying to clear up some sinus pus. But he puts in 3 holes, and he takes a very fine scope that he's co-created. And I think he said it was about $15,000 or $20,000 for this little scope that has a very, very small diameter scope, and you can't adjust it. You can't curve it. You can't hook it at the end. You have to angle it in according to the hole, and you can get some pretty good information. Although on a usefulness scale, his research has only looked at 8 horses, which I found fascinating. And he was able to get a final diagnosis in 2 out of 8. And to me, finding 2 out of 8, that's 25% of the horses, he could find a hematoma or sinus cyst. Or 3 out of 8, he could find a sequestrum or chronic sinusitis. Or 2 out of 8, he could find a mass not in the sinus and a fracture not in the sinus. And I guess that's really good. He could rule in or rule out certain things, but it seems like there's a lot of misses on that. And it's a pretty expensive piece of equipment. I appreciate him giving us this information and looking at it. I think it's great in a referral center where it will help you look to see if you should pull the tooth or not. And I think that's helpful. But if it doesn't say something, doesn't mean that it's not there. So that's going to have to be left in his hands or in the hands of very competent veterinarians who want to use it. That's not going to make it to your farm. The 8th segment was on blind wolf teeth. And according to this presenter, it's in 2.4% of all dentals that they do, which I'm not going to argue with. I think it's a pretty low number. In fact, usually what I do when I see these blind wolf teeth is I'll dig my thumb or my thumbnail into that area. I'll just dig into it. If the horse sits there looking at me, which happens in about almost every case, then I'm not worried about it. It's not going to bother the horse. People are pulling wolf teeth out all the time. I used to pull every set of wolf teeth out that I could. I've gotten much more conservative on that. I asked the trainer, are you having any problems? And if the trainer says no, then I'll say, okay, we'll just watch them. Blind or unblind. Blind means that the wolf tooth, instead of coming vertically down through the gum line and it's vertical, it stays horizontal in underneath the gum or underneath the skin or mucosa, and you don't see it. It's just It's there laying sideways, not even in the bone. So I can't imagine these causing problems. I've never seen one decide to come out all on its own, causing pain and disruption. I just don't see that. Wolf teeth, same thing. If they're bothering the horse, I pull them out. Or if the horse hasn't been floated and the person doesn't want to drug the horse, I'm like, fine, just leave them in. Let me get rid of all these other sharp points. I'll round it up. If I file the wolf tooth and it starts to rattle or it's loose, I'll take it out. There's just no question in my mind it's coming out. But if it's a solid tooth, it's got a good root system, I'll just leave them in. And I'm not seeing anybody, I'm not hearing anybody call me up and say, Doc, you should have taken that wolf tooth out. Now I lost the race. Now I lost the competition. I never hear that. I leave making sure that the trainer knows for sure that if that wolf tooth, if we clean up the mouth and you're still having a problem, I'll come back, I'll medicate the horse and I'll extract the teeth and we'll go from there. But chances are all these other problems in the mouth are going to help you more than anything else. And they never call me back. And then I'll come back. Well, not never. They'll call me back for 6 months to do another float. And I'll say, so how's this horse doing? Oh, the horse is doing so much better since you floated him. I said, so the wolf teeth aren't bothering. I forgot about the wolf teeth. I guess they aren't bothering the horse. I mean, that's just a common thing. And that's just with real wolf teeth. So the blind wolf teeth, I just haven't seen anything. I've had 1 or 2 people either call me or say, my trainer says this horse has blind wolf teeth. And I said, yeah, well, it's also sharper than can be on the very last bottom cheek teeth. And we're going to take care of that first. And I do. And the training issue is resolved and everybody's happy. And finally, the last section was the panel discussion where everybody came back and they were asked questions. And I sat through it. I found that what was interesting is it says, if the ditotamine at a high dose is difficult, add 1 ml of xylazine. I just laughed about that. I said, well, if you'd started with that and understood that it's pain, stupid, but I'm not going to call my colleagues that. They're not stupid. They just have been taught one thing. And I've been screaming several times that you have to kill the pain, and ditotamine does not kill the pain in the horse's mouth. So kill the pain in the horse's mouth, you're going to get much better results. They were talking about midazolam. Midazolam is now being used effectively in all equine practices as a replacement for Valium, diazepam, because the price of Valium and diazepam went through the roof. Midazolam, for whatever reason, is staying low price. And it's such a good medication to take these high anxiety horses and just to relax them, to allow the other medications to work. I use it effectively in a small percentage of the horses, but those that have it, they're just like, thank you. What's really interesting about midazolam is you're separating their anxiety center. So they stop worrying about it, and then they can understand that the pain is gone. And then the next time you come, they say, wow, that was a pretty good experience. And after 2 or 3 floats, they welcome me into the stall, literally saying, Doc, you don't have to give me any drugs. So let's just get this job done. I'm good. It's just an amazing medication that every equine practitioner should have. I've been using diazepam probably since the 90s. So 25 years, 30 years. It's just an amazing drug. Controlled substance, so you can't go out and buy it. And then one guy had a continuous rate infusion where he dripped in with saline, combination of Dorm and Torb, and just let it drip in. And he said that really helps some of these refractory cases he has to work on. So I think that's about it. Yeah, that's the whole shooting match of the American Association of Equine Practitioners 2021 whole section on advanced dentistry for field use. And I wish they would invite me on these panels. I mean, they know who I am. They certainly could ask me. I'm not going to knock on their door. I'm just going to use this podcast format to get out there and reach maybe some of the practitioners. Hopefully you're listening to this and understand that if your clients, if your horse owners are saying, Doc, I really don't want you to automatically drug my horse. I don't want you to jack its mouth open. I don't want all this other stuff. Fine. We need to respect them and offer other options. either say, yeah, I know another guy who can float this just using hand floats and without medication, or you can come and learn how to do it this way. Just give me a call and I'll be happy to work out the details, because I've got the whole Equine Dentistry School online, which is going through a revamp in this year, 2022. So I can help every veterinarian throughout the world learn how to do this online, and then learn how to practice on their own and get good at it. But anyway, it's just an option. I just think that if you've got several $100 million and you want to get a group of horses, let's say 100 horses, and keep them going for at least 25 years, and we divide the group into a control group where we don't do anything in their teeth, and the other group we start just floating teeth and see the difference. At least we would have a randomized controlled study that covers the basics of what happens when you just do routine floating. But we'll never get that. Nobody's ever going to do that. All I've got is 75,000 floats that I can look on since I've been doing this since 1983 and say, okay, in the 75,000 that I've done, that have partaken in, how many times have I seen this? And I'm still evolving, but I try to bring to everybody to the table some clear thoughts on this and thinking outside the box. And that's what I do here at the Horse Advocate podcast. Again, Doc T here. Thank you so much for joining me. Bye.
Hey everyone, Doc T here. Thank you for listening to my content. Would you do me a huge favor? Would you please subscribe, comment, like, thumbs up, and give a star review? However it's presented to you, I want you to do that. There's two reasons. The first, of course, is to improve this product. This way I know what you like, what you don't like, what I can improve upon, what topics you want me to cover. But more importantly, it's also going to help others find me. And by doing that, you are now engaged in this mission of helping horses thrive in a human world. By you helping, we can reach others. And that I would be so grateful for. And remember, go to thehorsesadvocate.com for updates on this information. Thehorsesadvocate.com. And again, thank you so much for being here. Doc T out.